My name is Melissa Crawford. I'm a family nurse practitioner, and I have been with Missouri Ozarks Community Health since April of 2022. Well, we have family that lives in Missouri in the Springfield area, and so we wanted to be closer to them, my husband and I, because we've lived in Colorado for a little while now, but we raised our kids in Missouri and just kind of wanted to be back home. I've been a nurse for 18 years. I went back to school to get my graduate degree for nursing, and I got my master's in December of 2021 and graduated with my master's in nursing and family nurse practitioner, and then took the exam and moved out here to start practicing. I've kind of worked in a variety of different settings in healthcare. I've done hospital, like medical surgical floor and the ICU for a while as an RN, but my favorite has always been family practice, or also working in like a federally qualified healthcare center, underserved populations, and those who maybe don't have insurance coverage. I feel like I'm creating access for patients who don't always have, the easiest access to healthcare. If you don't have insurance, people typically tend to try to avoid going to the doctor. That's expensive to go and have a doctor's visit, even if you have a need for some health care, such as your blood pressure maybe is high, or maybe you just have a simple cough or cold. If you don't have insurance, sometimes you won't, seek medical care. And by working in the rural communities with patients who maybe don't have insurance or don't have easy access to healthcare, you provide that greater opportunity for them to get the health care that they need and that they deserve. So I really like being, out in the rural part of America, and just, taking care of those people that, don't have as easy access to healthcare and to things that, some of our urban counterparts might have easier access to, the hospitals, the clinics, specialty doctors, all of those things. You have to learn to improvise when you work in a rural community and really find your resources. I'm here to help them. I really like to provide patient-centered care, safe care, accessible care. That's one of my main, mantras. I don't know. One of my main themes as a nurse practitioner is to make sure that I am providing care that's accessible and safe and patient-centered and good and reliable for them, so that we can do what's best for them and their health. Everybody's an individual. Everybody's a little bit different, and everybody's healthcare should also reflect that. We just love to be outside. I love camping, fishing, hunting, playing outside on maybe like the four-wheeler razor. They call them a razor now. Just kind of being outdoors. I have 5 dogs. People kind of think I'm crazy when it comes to that, because I have a lot of dogs. I have little Morkies, and they're Maltese Yorkie mix, and I like animals, and I love hanging out with my husband. We've been married for 29 years this year, and like I told you, I have 3 children, 5 grandkids, and just kind of enjoy life. Love the Lord and love my faith, and just like being a part of the community.